Hey y'all, it's Nurse KP. I am back with day 21 of the Maybe Mounjaro series. I would like to say thank you all for taking the time to come and visit with me another night. If it is your first time here, I would like to say thank you for taking the time to visit my channel. And if it is not your first time here, and if you are a returning viewer or subscriber, I would like to say, what are you waiting on to subscribe? Pause the video, subscribe now, and press the notification bell to get all notifications so you will know every time I make a video. Today's topic is going to be all about injections, all about the Mounjaro injections. So I have a demo pen, and we're going to go over how I do my injections. Mounjaro is a weekly injection thing. It is a spring-loaded pen that we inject into our cells subcutaneously once a week. For starters, we're going to pick a day that we can stick with. For me, my Mounjaro injection day is Wednesday or Thursday. And I say Wednesday or Thursday because I scale my days back from Friday to Thursday. And sometimes I scale it back from Thursday to Wednesday. If I forget to do it on Wednesday, I end up doing it on Thursday. Because with Mounjaro, you have up to 96 hours to take your missed dose before you have to start all over and the next week and totally miss that dose, and then just go to the next week and start your injection all over again. You can change your day within 3 days of each other, and you can miss a dose up to 96 hours, which is essentially 4 days. Now, Mounjaro is a medication that requires no mixing. It is a very easy to use, which is why we have these spring-loaded pens. That way, those of us who are vision impaired, we don't have to worry about drawing up any medication. We don't have to worry about carrying around syringes or vials, and we don't have to worry about measuring things out. So it is easy to use, and hence this is another reason why the medication is what it is, and there's no generic at this point for the medication. Legend, what are you doing? So Mounjaro is easy to use in 4 steps. So what we're going to do first is we are going to get our pen. Generally, we keep it in the refrigerator. Some people like to set it out for about 30 minutes to an hour before injecting, because it is to be believed that it decreases the pain that some people experience with injecting. I personally do not wait to do my injection. I take it out the refrigerator and I prepare it and go ahead with my injection. The primary injection sites get back the back of your arms that you can do yourself, your abdomen, within 2 inches of around the umbilical area, or your thighs. So to demonstrate how I do my Mounjaro injection, we're going to have our pen here. You're going to inspect it for any types of tampering, signs of use. If there's usually a green marker at the end of the plunger, that lets you know that it's full, it's ready to go, and you should be able to see that green marker. We're going to take the top off, and we are going to, in here, the demonstration pen does not have a needle, but in here there is going to be a needle, and there's no medicine in here. There's going to be a needle in here. That needle should not be sticking out by any means. It should still be inside of the pen, because what it is that we don't want to bend this needle, and we don't want to say have tampered with. So the needle is to be still inside of here when we get ready to inject. Then we're going to unlock our pen. We unlock our pen by turning to the right from lock to unlock from gray to green. We're going to select our injection site, which is my abdomen. My preferred place of injection is my abdomen. I rotate around the site. When I have a case of cellulitis, basically where it causes redness and irritation, it can lead to infection in that area. So we rotate around our sites so that we can prevent cellulitis. Then we're going to inject. You're going to press down. You're going to hear a click. You're going to hear another click. When you hear that second click, you hold it on to the site where you have injected it for 10 seconds. Now, once you're done with the medication, not advisable to recap it. However, do not recap it before you do the injection. You can recap it after you do the injection. And by recapping, I mean placing this back on to the medication and discarding it. Now, what is the best site for injection for maximum weight loss? That is $1 million question, because it varies from person to person. I have always injected in my abdominal area, with the exception of maybe one or two times where I've injected in my thigh because, I personally believe that it doesn't matter, but many say that for best absorption of the injection of Mounjaro is that you inject it into the front of your thigh. Do not inject it on the lateral side, which is the outside of your thigh, but more towards the inner thigh and on the front of the thigh, because that's where a lot of adipose is for a lot of people, and it's less painful. But for me, it was very painful, so I just couldn't tolerate it. So I went back to injecting in my abdomen, especially after the second time. I try to change it up, but it's just not one of those things I like to do. So, what do y'all believe is the best injection site for seeing maximum weight loss results? As I have stated, I've generally always injected into my abdomen. So I don't know. I just want to see what y'all say because it varies per person. Some have said that they've seen maximum weight loss results by injecting into the back of their arm. Now, the back of your arm be like up in here. Kind of difficult for some, but you can. And I'll try. Hold on. Injecting into the back of your arm is one of those things that you can do. It's just not something that I do. So you can inject into the back of your arm if your arms are long enough. If you have short arms, I'm sorry. I can't help you. You'll be more likely able to use your abdomen or your thigh area without any issues, okay? Rotating the injection site is very important for success on this journey. However, it seems to be some type of placebo effect where they inject like the different body parts, rotating amongst body parts. And by rotating them as body parts, I mean going from the abdomen to the arm to the thigh weekly in different areas, not rotating around the same area, but rotating entire different body parts. We don't know. We don't have the full research on that. I would love to see the research on that and come back with an update, provided I have one that's a reputable study. I'm losing my voice, y'all. I'm losing my voice. I'm rotating injection said it may be something that's a real phenomenon or it just may be a placebo effect. I am willing to find that information out and bring y'all back some valid information in the future. Now, for me, I personally do my Mounjaro injections in the morning because that's just how I get my day started. I'm not ripping and running around, and it is really generally before the children get up. So when I take my medications in the morning, because I try to get my Adderall in before 6 in the morning, so by the time I get to work, it's kicked in. I take my Mounjaro on my injection days. Try to be around 5:30, 6 o'clock in the morning, and it's before I even eat anything. For me, I don't believe that time of day does matters, but for some they do. I'm just doing the time of day that works for me for my injection day. Evenings, I'm too busy and I'm more likely to forget to do it. So I'm just doing basically what works for me. Now, complications can arise from injection site technique. It could be poor technique. It could be cleanliness. It could be, hopefully it's not dirty needles, because every pen that has been manufactured should be manufactured in a sterile environment. So it's generally maybe the cleanliness of the person, how their body deals with puncture wounds, and if there is any type of immunocompromised state of their health that makes them more likely to be susceptible to infections. So I do not use alcohol before I inject myself. A lot of people do, but I personally do not, and I have not had any type of issues with my injection since I have been on Mounjaro. However, if you are that person that wants that extra layer of disinfection prior to injecting yourself, I would advise that you use an alcohol prep or alcohol on a cotton swab the area clean, and then inject yourself. And do allow it to dry. Do not wave it, do not blow it, do not fan it. Allow it to air dry before you inject yourself. Bruising, I have not ever experienced bruising. However, bruising may be an occurrence that can happen while injecting yourself with any type of needle subcutaneously. If you are like on blood thinners, if you have any type of blood bleeding disorder, you may be more susceptible to having bruising from your Mounjaro injection. So it's advisable that you are watchful and careful of your technique and the bruising that can come with that. If you have any questions, comments, or concerns, don't hesitate to drop a comment below down here, or you can find me over on Instagram at NurseKP, and you can inbox me with any Mounjaro related questions. I will get back to you when I can because, you know, life. If you like this video, don't forget to like, share, comment, subscribe, and hit the notification bell so you can receive a notification of when I post another video tomorrow on the Maybe Mounjaro series. This is Nurse KP, and I am signing off for the night. Y'all have a good night, and I'm about to wash my ASS and go to bed. Good night, y'all.